Hey everybody, this is Jared from 45 Urgent Care. I wanted to talk to you today about a subject that's kind of rearing its ugly head during this pandemic. And what I'm going to talk to you today about is our children. So something I've noticed both as a parent and as a clinician is we're starting to see a lot more rise in depression in kids, and we're starting to see some increase in headaches, neck pains. A lot of this is stemming from two factors. One is the social isolation that everybody's experiencing. Kids right now have been stuck in their homes for the past few weeks or months. They're not really getting to go out to school. They're not getting to go to scouts, sports, gymnastics, whatever their normal outlet is, church, for example. And so they're starting to feel really isolated. The thing about kids that's different from adults is kids don't always readily express how they're feeling and what's going on with them. They just start to get more withdrawn. They start to get depressed. They start to get more irritable and angry, but they won't really tell you why. And so just some signs to think about and some ways to help your kids get through this. Some signs to think of would, again, reduced appetite, loss of interest in family activities, poor performance in school. I know a lot of kids right now are going to virtual school, or they're going online classes or even paper packets. And you may have noticed a dip in some of their performance. A lot of that will tie back into that depressive state or that area where they're not very socially involved, because again, kids are very sociable. They want to be with their friends, and right now they can't. So one thing that we can do to help as parents or grandparents or guardians is to try to find creative ways to get some social activity with your children. One idea is to maybe have like Zoom meetings with their friends. So like the old school play dates, except online. So they can still interact, they can talk, because even when they're doing their Zoom meetings for school right now, they don't really get a chance to really talk with their classmates because they have to remain quiet just like they'd be in the classroom. And so that's one thing you could do. Another thing you can do is find safe avenues for outings. So maybe nice open area parks where they can still see their friends, interact with their friends, but still maintain that safe social distancing that's been recommended. Another thing along those same lines is to get the kids out of the house. It may even be as simple as something as a shopping trip to Walmart or Kmart or something like that, because it's going to get them out of this environment. They've been looking at these four walls for the past few months, and it's just stagnating their brain. So get them out of the house, find a park, find a some kind of hiking trail in this area. I know around Jackson we've got stuff like Cypress Grove, we've got Pinson Mounds, Chickasaw State Park. Get them outdoors, get them some fresh air, some sunlight, because they're really craving something, some sort of stimulation beyond just what's on their TV screens. Another thing to do is they can just call their friends. Nobody really has landlines anymore like we used to when we were kids, but get the phone numbers of their favorite classmates and their best friends, and just have them call and just say, just to interact and reconnect with some of their friends. Another thing that we talked about was the musculoskeletal things. That's what I'm seeing. I'm seeing neck pains, eye strain, headaches. A lot of that's going to come from two factors. Poor posture, which is affecting all of us. That's a lot of people that are working from home now are doing more computer work, more laptop work. And so we're looking more down at the screen. We're stressing out that neck. When the head goes forward on the neck and the shoulders, it acts as a counterweight. So for, say, 60 degrees of forward flexion in the head, we can estimate that that's like an extra 60 pounds of force on the neck that's not normally there. So posture is very important for both children and adults. Another thing that we're seeing, again, is the headaches and the eye strain. So when we look at things up close, our eye muscles have to work. They have to be activated in order to focus on things that are up close. Continued focus at near vision is what is causing a lot of eye strain, a lot of headaches. When your child is sitting at home for 8 hours on a laptop doing their Zoom classes online, they're going to start seeing all that eye fatigue, headaches, migraines, and neck strain. So what I recommend is for every 30 minutes to an hour, or maybe between lessons, however you want to break it up, have the children look out their window. Have them focus at something in the distance, whether it's a cloud or the neighbor's backyard or whatever it is. When we look at things far away, our eyes relax. They don't have to have active muscles to look at things in a distance, okay? And that's a good advice for anybody, adults and children. But children may not realize as much as we do what's causing some of their issues, so they don't know how to fix it. So I'm just giving you the tools that you can do to help fix that. As far as the neck strain and the posture, when they're at home, if they're sitting on a chair holding their iPads doing their lessons, then try to find a way that will elevate their iPads or their laptops, whatever they're on, so that they're looking in a more neutral position. So the back is straight, the neck is straight, and they're looking straight ahead of them. So whether you can stack something on books or lower their seat so they're higher up, those are things that are going to help. So again, reducing eye strain, reducing neck strain, and increasing kids' ability to socially interact with others, or even just to get outside with the family. All of those things are going to help not only your kids, but it's going to help you as well. Because again, a lot of people are, working from home right now. And so these are new for adults as well. If you have any questions about what I've talked about today, or you want some more tips and advice, please come see me here at 45 Urgent Care, and I'd be happy to answer any questions you have. Take care.